So it's time to start squirming in your seat. Why now? Because it's time to talk about sex. Yep, sexuality. Well, actually, we won't be going into that much detail. But seriously, sexuality and how to deal with it when you have Crohn's is a pretty hot topic. You know what I mean. Now, at the best of times, intimacy with another person can be a challenge, especially when we are at the beginning of a relationship. We tend to want everything to go smoothly, without a lot of stuff to manage. But when your stuff includes the symptoms of Crohn's disease, you can't always count on things going exactly as planned. Let me explain what I mean. First of all, simply having Crohn's can affect your sex drive. Even mild GI symptoms can drive you to distraction, especially if you have persistent diarrhea or stomach cramps and are worried about an urge at a very inopportune time. If your disease is active, your GI symptoms may reach the equivalent of a tough stomach flu and are likely to further diminish your interest in sex. Plus, you may be more tired than normal and even slightly undernourished. So don't be surprised if your sex drive is taken down a few notches. But don't go running to a monastery or nunnery just yet. You can manage. I'll let Joan take it from here.
Thanks, Dr. Menon. Yikes, sexuality and intimacy. Well, it's a broad topic. And a lot of how you approach it depends on where you are in your life and with whom. An adolescent or young adult may have a much more difficult time with their own body image and sexuality than someone older, who may also have the advantage of being in an established, loving relationship. But I can assure you that for anyone with Crohn's who is sexually active, honesty is the best policy. I know. Easier said than done. But consider this. When you're upfront about your condition, you achieve a few things. First of all, you eliminate your need to hide your symptoms and make excuses for not feeling up to an outing or date. Second, you're allowing the other person to better understand you and your needs, which is essential for any intimate relationship. And third, you may even open the door for the other person to be as honest and trusting as you are being, which can only help a relationship grow and mature. As far as the important facts about sexuality and Crohn's, they're pretty straightforward. First off, the ways in which Crohn's can affect your sex drive have already been covered by Dr. Menon. But know that any person with a chronic condition will go through times of reduced interest in sex when their disease is active. Now, Crohn's doesn't directly involve the sexual organs, though for many women, a fistula may develop that connects to the vagina and will likely require medication, surgery, or both. And while we're on the topic of surgery, following any operation for Crohn's, strenuous activities, like sex, will have to take a back seat to the healing process. When it comes to the effects of Crohn's medication on your sex life, you'll be happy to know that the common treatments do not have any particular effects on sex drive or performance. Women who are prescribed antibiotics may develop a vaginal discharge, but this is in no way dangerous and may only be a temporary inconvenience. For people who have an ostomy following surgery for Crohn's, the devices worn to manage waste from your body may at first be an inconvenience or a cause of embarrassment for some, but there are simple and effective ways to manage your concerns and lots of resources to get you started. In terms of fertility, Crohn's patients are as likely as the general population to conceive a child, though during a flare there is evidence of reduced fertility and an increased chance of miscarriage. Still, this is generally good news for those men and women who want to become parents, and a reminder to use effective contraception for those who do not. Also, if you're taking methotrexate for your disease, it's essential that you use contraception if you are a woman, as this drug can cause serious birth defects and pregnancy complications. For that matter, since very little testing is done on pregnant women for most prescription drugs, you should speak to your doctor if you're considering becoming pregnant while taking medication for Crohn's, and to use contraception as a precaution. For those of you who are parents of preteens with Crohn's, you should know that your child's sexual development may be slowed by medications, but they will eventually catch up. I won't get into the details of the implication of Crohn's on pregnancy and beyond, except to say that Crohn's shouldn't stop you from becoming a parent, and that you should discuss this with your doctor when you're ready.
Thanks very much, Joan. Now I would like to show you a quick video of a young person with Crohn's who's dealt with many issues of sexuality and intimacy in her life and wants to share her story with you.
Hi, my name is Ashley, and I'm a certified personal trainer and yoga instructor, and I love to compete in triathlons. I'm a Bachelor of Science graduate and have plans of becoming a gastroenterologist. I was diagnosed with Crohn's at the age of 16. I've been working hard to manage Crohn's for about 8 years now. However, I've had symptoms since I was 9. So really most of my life, I've been trying to deal with my troubled gut and to live a normal life, full of friends, fun, and yes, from my mid-teens on, a boyfriend. It's worked out pretty well so far, but not without a few bumps along the way. Here's what I've learned that I think could help you. First of all, don't hide your condition from friends, especially your partner. It won't help anything, and it will only make things confusing if you disappear during a flare. I've tried it before, and it blew up in my face. You know, while you're in hiding, trying to get through a flare, your boyfriend or girlfriend is busy wondering why you don't see them, and thinking it must be their fault, and the spark goes out pretty quickly. I'm not saying to tell someone you're attracted to right away that you have Crohn's. Just wait till it comes up, I guess. But don't hide it. Now with my condition, I have about 4 flares a year, and I often take steroids when they happen, which can make me put on weight and get a bit of a moon face. Not too bad, but not so good when you're trying to look your best for someone. But that's why I stay open about Crohn's, because some things you just can't hide. Besides, I've learned that when it comes to being attractive, it's more important to be comfortable with yourself, which is my second point. For me, that meant learning as much as I could about Crohn's and meeting other people with the condition to help normalize it. I got involved with the CCFC and met lots of great people, which helped build my self-confidence as well. As far as being sexual, I would say Crohn's flares are the times when that part of my life is definitely put on hold. Low energy, pain, diarrhea, these are not exactly a recipe for a romantic night. So I listen to my body and let the important people in my life know when it's time to lay low. Looking ahead, I'm concerned about surgery and getting pregnant and what might happen if I flare then. But the people I know who have been through all that, well, they got through it. And I know I can too. As long as I don't hide, I know I won't be alone. And that's my advice to you.
Want to learn about the importance of family and friends? Or do you need to look at the menu to decide where you want to go next? Make your choice.